me figure this out. Boom boom bing bong boom 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 bop bing bong bing bong. Okay, live on YouTube as well. What's up? YouTube. Test. Live on YouTube as well. What's up? Okay, it's going good. All right. Okay. I'm gonna wait till the ads are done, and we can figure out what's gonna go on. Cause I might have to to switch mics. I don't know. Fucking thumbnail, dude. As a river. Okay. So my audio is good right now when I'm right here, right? But if I'm over here, how's my audio sound? Can you still hear me? Can you hear me when I'm all the way over here, or no? How's the audio? You can? Okay. Alright, so what we're doing today, if you haven't noticed, this is a very different fucking angle than normal, okay? So the reason this angle is different as shit is because I'm doing something different today. I'm going to be doing practice for EMT. Also, you know, noticing the outfit. I was going to wear my full outfit, but I decided just to wear this regular shirt. But yeah, so it looks a little funky, but I'll just untuck it. Looks like an old man if I don't untuck it. It's just you and I have the full thing. So what we're doing today is, yeah, so we're doing EMT practice stuff. So I have my final EMT stuff next week, and then I'll to pass, and then so basically next week I'm doing practice for my EMT stuff, bro. What's going on? So next week, basically, I have on Monday I have a quiz. Tuesday I have a block exam, and then Wednesday I have my major big skills test. So how do you not know what an EMT is? Right? Emergency medical technician. So it's basically, you know, people in the ambulance. It's not the paramedics. It's the EMTs. So paramedics are higher than EMTs. Okay. So I keep like trying to look at the camera, but the camera's right there. So basically, I'm doing. Today we're going to be practicing the skills I have to do for the EMT test and seeing how well I do. Because I need to pass those to become an EMT. And then Thursday I have my written test. So I have to study for that separately. So after I finish this, I'll be doing some studying. And my hair looks like shit because I didn't put any product in it today. Because I had a haircut at 1 p.m. So in like an hour and a half. So that's why my hair looks like shit. Okay. Normally I'd have it fucking all nice done for you guys. I wasn't even gonna wear these headphones, but I'm probably not gonna wear them honestly. Yeah, new camera angle unlocked. So basically today what we're doing, just to update the new people that just came in, is we are doing EMT practice. So I'm going to be running through the script I've had memorized for the most part. If I make any mistakes, I do have the actual main thing on my monitor, so I can check if I do think I made a mistake to make sure I don't make mistakes. We're just doing the big EMT, go through the rigmarole of what I need to know, all that stuff. So we're going to start off with a medical assessment, which is basically, say someone's having chest pain or breathing issues. Then we're going to go through a trauma where, say, someone's bleeding, or someone is someone's bleeding, or they have they need a splint, like they have a fractured leg or something, right? And then after that, we're going to be doing a mega code, which is mega code's really interesting. It's a lot of steps. Traumas takes the most time, so it goes medical. I think it's probably the easiest ish. Trimming stuff. Oh, hey, who wants to be a volunteer? Okay, all right, and you guys are gonna help me out. So you guys are gonna kind of choose what scenario I'm doing to begin with, okay? So we're gonna do medical assessment. Do you guys want someone to be having a heart attack, or do you want someone to be having like a breathing issue? Which one do you guys prefer? Because those are the two things I might be testing on. I'm testing on either someone's having a breathing issue or someone's having a heart attack. So which one should I do first, guys? Okay, Heart attack has a little bit. So heart attack, let me think. So the only big difference is it'll differentiate between a certain thing I ask for the two. If it's respiratory, I have to go through like a different section of things, but heart attack I have to go through a separate thing. But yeah, we'll do it. Well, heart attack depends on, I have to ask certain drug names, so we'll do heart attack, okay? So let me steal this shit here. So we have to improvise, because I don't have an actual dummy with me. This is gonna be Kevin. So this is Kevin. He's having a heart attack. He called 911, which reporting chest pain. And so I'm gonna go out there and we're gonna see what's going on. How do I get this angle so you can actually see my face? How do I do this? There we go. Is that my face in it? This angle is horrendous. What the fuck? I'm just gonna kneel. Which kneel? Well, it's not just so. For instance, I'll just go through. All right, we'll do a big go through. All right, so BSA scene safety. Let's see. Let me make sure I'm in the shot well. I'm not in the shot. You can use the mirror for my shot. That's crazy. Let me move this mic down right here. Is that good? Is this good? This is okay. Okay. All right. So BSIC safety. The scene is safe. I'm going to be putting PPE on. I'm looking for any environmental hazards. I don't see any. Seems to be one patient right here. I'm going to be calling for. Seems like it's going to be nature of illness. It doesn't see any trauma or anything, but I will keep that in mind just in case. I'm going to be calling for additional resources just in case I do need those, and if I don't, I can always cancel. And again, I believe I said, but one patient, and then I might need to extricate. May need C-spine. I don't think I will need a C-spine. Who knows? Oh no, the cat's having a heart attack. Oh no! But maybe I'll need a C-spine. Maybe I won't. It doesn't seem to be a neck issue, so I'll bring it. But if I don't need it, I won't use it. All right. So that's the first main thing. I'm saying it's safe, and then I go through Penman. Okay. So the next, I'm going to be going through my general impression. I see a older man sitting in a chair, clutching at his chest. Seems to be like not a little bit wincing. Skin looks a little bit pale. Is that what I see? That is what I see. Okay. So hello, sir. My name's Jay. What's your name? Oh, it's Kevin. Okay. Hi, Kevin. How old are you? And when I'm shaking his hand, I'm feeling for his radial pulse. How old are you, Kevin? You're 65. Okay, Kevin. Okay. This probably looks like I'm having a mental breakdown. Okay, Kevin, so you're 22. Where are we right now? Okay, we're at home? Okay. And, what year is it? Oh, okay, it's 2024. Okay. And why were we called out here today? Oh, it's really hurting your chest right now. Okay. All right. Well, thanks for letting me know. So now I've gone through that. So now he's alert and oriented times 3. So we know Kevin is in his right mind. He's not having any issues with his level of consciousness. So now we're going to be looking at, life threats and chief complaint. So do I see any life threats? No, he's not bleeding out. He doesn't seem to be having any life threats currently. The snooze ads. No ads right now. Okay. Ads are snoozed. Okay, so he's not having any level of consciousness issues, and his chief complaint right now is of chest pain right around this area, okay? So now we're going to do ABCs. So his airway seems pain and maintainable. He is having a conversation with me, so he doesn't seem to have any issue with his airway. Breathing wise, I'm going to throw a pulse ox on him, see what his reading is, as well as looking for equal and bilateral rise and fall of the chest. Pulse ox he's at like 85, so I'm going to get out a non-rebreather mask, put that on him. Through the oxygen tank, and be running 15 liters per minute just to make that oxygen stat up, because that is not a great stat to have. Just wanted to get that up a little bit. And then now looking at his circulation, I'm looking for skin, so I'm feeling for temperature, and I'm looking at skins. He seems to have he's kind of cold. He seems to be like pale, cool, and diaphoretic, which is not good. You don't want to have someone pale, cool, and diaphoretic. And diaphoretic means sweaty. So I don't really want someone that's pale, cool, and diaphoretic. So what do I do? What do I do now? So I've done circulation, so now I'm going to be looking at, this is a priority patient, and I want to begin transport on Kevin. So Kevin, I want to get you in the back of my ambulance, so we can take you in, because I want to make sure that we can make sure everything's okay with you, okay? So now Kevin and me are going to go to the ambulance. Now we're going to begin our questions. So, Kevin, so now we're doing OPQRST, which is, okay, Kevin, when did this start? What were you doing when this happened? Oh, you were just sitting in a chair. You weren't really doing anything. Okay. And is there anything you do that makes it feel better or worse? No, not really. Okay. If you had to rate this, if you had to describe this pain in one word, what would it be? So that's asking the quality of the pain. So I can see if it's a stabbing, a crushing, a squeezing pain. It's a crushing pain. Okay. And can you point with one finger where this hurts? Oh, it hurts right here. And does it move around anywhere? Oh, it moves to your arm a little bit. Okay. And if you rate this on a scale of 0 to 10, 0 being no pain at all, and 10 being the most pain you've ever been in your life, what would it be? About a 7. Okay, that's not good. We want to get that taken care of, okay? So when did this all start? I don't have my watch on. Oh, this started about 30 minutes ago. Okay, I would note that down. That started about 30 minutes ago. W position in it. Okay. Okay, so now we've done OPQRST. So now based on what he said, I'm going to ask 3 special questions. So Kevin, have you had any dizziness or nausea today? You have not. Okay. Have you had any, vomiting with that? No? Okay. And have you had any direct injury to your chest? You haven't. Okay. So right now, everything seems to be saying that he is good. He doesn't seem to be having any of those other issues, so I'm not super worried about that, right? And if he was having a breathing issue, we would have done the acronym PACE, which is just going through the things for breathing. He doesn't have those. So now we're going to go down to ample. Kevin, do you have any allergies? You're not allergic to anything, okay. And are you currently on any medications? You're on aspirin and nitroglycerin, okay. Okay, so now that's keying us off to that he has medications based on this, right? Aspirin and nitroglycerin. Now you get the aspirin part right. Good job. Okay, and what is any past medical history that I would need to know? You had a heart attack 3 years ago. Okay, that's important to know. Thank you for letting me know that, Kevin. And when did you last eat? Wait, an hour ago. Okay. And so right now, just so I can repeat everything back to you, sir. Kevin, you are saying that you are prescribed aspirin and nitroglycerin. You had a heart attack a couple years ago, and basically you ate an hour ago, and you've been having this pain for about 30 minutes. So is that correct? Okay, perfect. So now I've gone through, explained it back to him, so he knows that I understand what is going on with him. So now what we're going to do is IPA. We're going to inspect, palpate, and auscultate. So Kevin, I'm going to move your shirt down a little bit so I can see, or am I just asking to take the shirt off? Kevin, can I take your shirt off? All right, Kevin. I'm going to put my hand on your sternum. I'm going to push in. Tell me if this hurts, okay? Does it hurt? No? Okay. Now I'm going to put my hands on your ribs and I'm going to squeeze it in. Can you breathe in when I do that? Okay. Did that hurt, Kevin? No? Okay. So now I'm going to listen to your lungs. I'm going to listen here. So listen here, here, here. And then on the back, I'm going to listen here, here. And then I could listen here again if I want, but I'm not going to. So I'm going to listen there, right? Basically, it all sounds good. Perfect. We got the vitals done. So now we're going to move on to what I'm seeing. So right now I see a elderly man, 65, presenting with chest pain. He has a history of heart attack, but he has certain medications prescribed to him. So now we're going to be going on to kind of like, I believe at this point he's having some kind of chest issue, some kind of, chest pain issue, right? So what we're going to do now is we're going to kind of figure out what do we want to do. We want to interventions. All right, so I'm going to call up medical control. So first, Kevin, have you taken any of your aspirin or any of your nitroglycerin today? Or yesterday? Have you taken it in 48 hours, sir? You have not. Okay, he's not taking any of his medications the last 48 hours. So now I can continue on with this. Okay, Kevin. So I'm going to call medical control and say, hey, this guy has these stats. When I ask his vitals, let's just say his vitals are like, I'm trying to think, let's see, let's say it's 130 over 90 for 130 over 90, and he has a pulse of 85. Not great, not amazing, not horrible, but not great. So based on that one number, with 110 over 95 or whatever I said, or 130 over 95, if it's over 100, I can give him nitroglycerin if he hasn't taken it, and he isn't taking it. So, sir, this is your aspirin, correct? So now I'm going to go through the 5 rights. This is your medicine. This is your prescription, right? Okay, and this is the right medication for this situation. Aspirin is used for this situation. Okay, and this dosage, it says it's 81 milligrams per pill, and I'm going to give you 4 pills for a total of 324 milligrams of aspirin, okay? They usually only prescribed 1 a day, but I can give 4 because of the situation. Okay, this is the right dose, okay? Now you're going to eat this, you're going to have this in your mouth, and you're going to chew it up for me, okay, sir? So that's the right route, and then this is not expired. This is still a valid prescription. This is all relaxing. I'm glad to think. So this is the right medication. Everything's good for him. So, sir, I'm going to take 4 pills. Here you go, sir. Can you eat these and chew them and then swallow? Okay. And we're going to keep watching your vitals on that, based on that. Okay. So now he's taking the drugs. So now, sir, you have this nitroglycerin. Nitroglycerin has some counterindications. All right, sir. I know that you haven't taken any of this today or yesterday in the last 40 hours, but I need to ask you some questions. Are you on any sexually enhancing drugs like Viagra, Cialis, or Velitri? No, you're not. Okay. And are you on any pulmonary hypertension drugs like Revasio, Flolan, or Levitra? No, sorry, Levitra. I think Levitra sex. Let me Google this. Levitra. Is Levitra sex? Let's see, what's Levitra for? Levitra. Oh no, it is. It's, okay, I'm good. I was right. There's Velitri. Velitri is okay. So Velitri is the thing. Okay. Snooze the ad break again. Yeah, Kevin's chilling. He's chilling. So Velitri is going to be a Let's make sure. I don't want to mix them up. What is Levitra 4. Levitra is for erectile dysfunction. Okay, so Levitra and not Levitra. So I did mix that up. So are you on any sexually enhancing drugs like Viagra, Cialis, or Levitra? No. Okay. Are you on any pulmonary hypertension drugs like Ravacia, Flolan, or Velitri? You're not. Okay. So if he was on either of those, that would be a counterindication, and I cannot give him the nitroglycerin because he's not on any of them. I can give him the nitroglycerin. Okay. So I'm going to give you zero point 0.4 milligrams of this. Okay. So can you open your mouth and raise your tongue? This is given sublingually. Okay, I gave it to him. All right. And now, Kevin, while we're going on the way to the hospital, I'm going to check you every 5 minutes for your level of consciousness, as well as checking your vitals to see if the medication I've given is working or not. And if it is working, and I can still give it to you again in 5 minutes, I will give you more of the nitroglycerin. If it is working, but it's working so well that it's now below the certain range, I will not be giving it to you. If it's below 100 for your systolic, as well as if your pain is gone, I'm not going to be giving you anymore. Okay. And then basically once I get there, I'm going to tell them basically this is a 65-year-old man. He was complaining of chest pain. And one of the things when I looked at his chest, I should have verbalized this more. When I looked at his chest for inspection, when I looked at his chest, it's kind of hard. It's not a person or a dummy, so I'm not thinking of it as much. But I'm looking for any drug patches, cabbage scars, just from like a heart surgery, any pacemakers, any bruising, scarring, anything like that. I'm not seeing those. And then so because of that, yeah, he's good. So I did make a few. I just skipped that one thing. But other than that, I think I did pretty good. I should have practiced that a little bit more. I haven't done medical for a long time, so it's a little bit harder. But now we're going to be moving on to trauma. Oh, so someone is on my document right now because I gave that to some of my friends. Someone is on this document right now. Welcome, that person. They do happen to technically be watching, which I highly doubt because no one knows about this. All right, so now we're going to be doing a trauma. Dude, my fucking knees. Oh my gosh. My knees. Okay. So we did the medical, so now we're going to be going on to trauma. Trauma is a lot fucking longer and more annoying. So we're going to do trauma now, okay? Trauma. I said trauma. Do we want someone to have gotten shot? Or do we want someone to have broken an ankle? What do we want to do? And the reason I'm doing shot is because I want to practice more with through wounds rather than stabbing. So let's do shot. What do you mean? E or T button? EMT? Well, look, the ambulance is here. Vroom, vroom. So I didn't get it for the bush. Push it? Push what? Oh, I can't. Oh, yeah, there's a thing. I can't hear any of the sounds right now, by the way. So I can't hear anything you guys do. I don't know if they work. So, risk it. I'm uncomfortably erect, I know. Okay. That's what the thing was. So basically, now we're going to go on to a trauma. Okay. So trauma. I'm just going to sit here while I do it because my knees fucking hurt now. But we're going to go through it, okay? Get the angle good. Alright. So basically, for traumas to be very similar, so we will do those after the trauma, okay? Remember that. Alright, so basically, scene safety, the scene is safe. Basically, I'm going to put my PPE on, looking for any environmental hazards. I don't see any. Seems to be one patient, let's see, yeah. One patient seems to be like a mechanism of injury because this dispatch told me that someone got shot. So I do seem to be a mechanism of injury. I might have to move this camera to see more. A mechanism of injury. I'm going to call for additional resources. If I don't need it, I will cancel. And at this time, I may need C-spine, so I will bring C-spine. So now we're going to trauma. Okay. So my general impressions of the patient. The general impressions of the patient is I see a scratching board for a cat. Is that what I see? No, what I see is a 25-year-old man on the, he's laying down on the ground. So the traumas are almost always on the ground. Let me move this over. At least all the ones that we've learned for. So they're on the ground right now. So how does that work? Can you see him? You can see it. Yeah, you can see it right there. Okay, so we're on the ground with this person. I see. Right, so the general impression is I see a 25-year-old man on the ground, seems to be having a hard time doing things, okay? And do I see any life threats? He's bleeding out on his leg. Let me get his limbs in the correct spots, okay? These are his arms, everybody, okay? These are his arms. These are the legs. We're going to work with this, okay? We're going to work with it the best we can. Can you see the legs? You can barely see the legs, probably. If I do this. This work? Can you see the legs now? Oh, yeah. There's the legs. Here are the legs. Alright, perfect. This is super scuffed, okay? Alright, so he's bleeding out. We're just saying he got an arm. He's bleeding out of his arm, okay? So, life threat. That's the most important thing. So I'm going to get my tourniquet out. I'm going to wrap it up here. I'll wrap it around and I'll go through the thing. I don't have an actual tourniquet to show you guys. I'll go through the whole thing and I'll tighten it, and then I'll go here and I'll twist it till it's no longer, so there's no longer a pulse in his left arm, no longer a pulse there, and there's no more bleeding. And I'm going to write the time down on the tourniquet. Alright, so that is now what I've done. He has a tourniquet on his arm, it's wrapped up, and now I don't see any bleeding, there's no bleeding, there's no pulse if I feel for a pulse, and yeah, so I've taken care of that life threat. Yeah, so life threat is good. Push it. Alright, let's do it. Let me pull up Chatterina so it's easier to see one sec.
Hello, chat.
Chatterina. There's Chatterina. Someone say something. There you go. Alright, Chatterina's up. Was there an ad? Ooh, ad. Oh my god. Alright, so that's taken care of. So now that we've taken care of that main life threat, now we're now it's working. Okay, perfect. Life threat's done. So now I can go back to what I was doing previously. Okay, life threat's taken care of. Hello, sir. I'm your EMT. My name is Jay. What's your name? Your name's Kevin. Okay, Kevin. So it's Kevin. Kevin's having a hard time. Okay. So hi, Kevin. What is how old are you? You're 22. Okay, perfect. 25. I guess I did 25. 25. Okay, Kevin. So Kevin's 25. And then, where are we right now? We're at the park? Okay. And, what year is it? It's 2024. And what happened today? Why were we called out? You got shot by the ops. Okay. You got shot by the ops. Good to know. Okay. So you shot by the ops in the park. Not good. Not fun. So here's this thing. Oh, yeah. If you're tired, you go get some rest, man. Go get some rest. You're all good. Alright. Got shot by the ops in the park. Not fun time for him. So right now he's learning 2x4. Yeah, the ops, bro. His ops drove by on their fucking buggies and right. So, alright. So we did all that. So he's learning 2x4. So has no level consciousness issues. So now moving down, I'm going to be now looking at chief complaint. So his chief complaint is he got shot in the arm and it really fucking hurts. Okay, it hurts a fuck ton. Okay, good to know that's a chief complaint. Alright, so now ABCs. His area is patent maintainable. He is talking to me. He is breathing like an equal and bilateral rise and fall of the chest. I do see that. I don't have a pulse ox, but I do see that it is equal and bilateral rise and fall of chest. And it does seem to be labored. It is labored. Okay, so we're gonna put him on 15 liters of oxygen per minute with a non-breather from the oxygen tank. We just do that. Boom, boom, boom. Okay. And then now, circulation-wise, do I see any other bleeding other than that bleeding that's no longer happening? I do not. Okay. I'm looking for if his skin's is it pale, cold, diaphoretic? Does he look like he's having that is true? He is true. Okay. So we have a plan to do something for that. So he's in shock. He's lost enough blood. He's now going into shock. We can't do anything with it out here. We want to get him into the ambulance ASAP. So we're going to go through the rest of the things until we can get him in there, okay? And I'm looking for a pulse. There's no pulse right here, which is expected, but there is a pulse here, which is good. Okay. Now he is a priority patient, and I want to prepare him for transport. But because he was saying he also has some back pain, because he got shot and then he fell on his back, and it really hurts. This is a C-spine case, so we can't move him until we do C-spine. We have to do C-spine, we have to do these things. All right? So I believe I do, let's see, I made a check to make sure I'm doing this right, because I'm pretty sure I do PMS first, right? I always prepare this one thing. Since it is one thing he's priority patient, I'm making him trauma naked and cutting all his fucking clothes off. He's fucking naked now, basically, okay? He's trauma naked, okay? That plus, I'm going to now go behind him and say, okay, Kevin, feel behind your neck for any step-offs, which is like the spine has an issue, any step-offs. I'm feeling for any tenderness, and I'm looking for any bleeding on my hands. I don't see any, I don't have any of those. So I'm going to take a C-spine. I don't have a C-spine to show you guys. But what I'm going to do with this, no, first I'm going to do PMS. All right, Kevin, Kevin, I'm going to take bilateral pulses. There's no pulse on this side, but there's pulse here, as expected. All right, Kevin, can you squeeze my hands? He squeezes both my fingers. Okay, good. All right, Kevin, and what finger am I touching? Your pinky, and what finger am I touching? Your thumb. Okay, he's good on those. That PMS. Now we're going to enter down the feet. Okay, bilateral pulses. Okay, there's good pulse. He has pulse in both feet. Can you push down like you're on a gas pedal? Can you raise your toes to your nose? Okay. And am I touching the inside or outside of your foot? Outside. Am I touching the inside or outside of your foot? The inside. Okay. PMS is done, making sure that he has all the ability to use all of his things. If he doesn't, that signifies a much greater issue that we need to address. So now I'm going to measure for C-spine. This is how this is his head. I'm going to feel from his trap to his chin with my hand. It tends to be 4 fingers. And then I'm going to size the C-spine. And what I'll do is, this whole time, I have a partner that's holding his neck and head and spot. So ever since I did the need for C-spine, I've had my partner do that. I'm going to now slip this underneath his neck. I'm going to tighten it up. And now he has that on him. Okay, so now he has a C-spine on. So now everything there is good. So now we can roll him. We're going to log roll him. So I need a bystander because there's only 2 of us. Bystander, come over here. So basically, this is his injured side. So we never roll him onto the injured side. We roll him onto the other side. So what we would do in this situation is I would put my hand on his pocket and his shoulder over here, like this. And then I would have a bystander with me, and they'd be holding on. So my hand's on the pocket, and then their hand's going over my hand to the belt loop, and then the other hand's on the knee. And then the person in the head, I'm going to say, on 3, you count down from 3, and then we're going to roll him. So they say 1, 2, 3. We roll him onto the side, and then I'm looking in the back, and I'm feeling down for any step-offs, for any bleeding or any tenderness, for any BTLS, which stands for any deformities, contusions, abrasions, penetrations or punctures, then bleeding or burning, any tenderness, any lacerations, or any swelling. I don't feel any. I'm also looking for any incontinence. Has he shit, pissed, or cum himself? I don't see any of that, okay? Seems good there. None of those. Perfect. Good job, Kevin. Okay, and then now that he's up, we're going to have the backboard moved underneath him, the backboard's under him, okay? And then on your call, person to the head, on 3, you're going to count down, we're going to roll him back, okay? 1, 2, 3, roll him back down, okay? Then again, on 3, we're going to move him down more center, okay? 1, 2, 3, move him down. Now we're going to move him back up so that the bottom of his ear, the top of his ear is at there's going to be like on the backboard, there's a little like headrest. And on the top of his ear at the bottom of the headrest, okay? So 1, 2, 3, we move up, he's in the right spot. If he's not, I just reposition him again. But in this case, he is in the right spot, everything there is working. So now he's on the backboard. Now I'm going to take duct tape, I'm going to wrap it on the corner up here, and I'm going to go underneath the C-spine. So it's going to go underneath here and attach here. And the other one's going to go across the top of the head where not yet. Undo that. Now that he's here, it's hard to do it when you don't see everything. We're going to now strap him in. We're buckling here, and then at the chest, and say, okay, Kevin, take a big deep breath for me. Okay, I'm going to buckle it. Okay, you can let that out now. So now he can still breathe without his chest being infected from the tightness of that. Okay, that's good. Now that that's done, we're going to put, and he's on the backboard, we're going to put 2 blocks next to his head, like right here. And then I'm going to put this, like one little thingy, kind of rests here and goes across. We're going to put that on. Okay, and then we're going to put duct tape from here to here and here to here. I'm twisting it so that he actually does not get the duct tape stuck to his head or anything like that. So he is okay. So now we've done all that. Oh, what did I say? Duct tape? Let me check. I need to move that one because we would not do the duct tape here yet because he's not on the thing. I need to update my instructions because we wouldn't do the duct tape until he's onto the backboard. I just have that flipped. I'll fix that. Okay. But yeah, now he's on. He's strapped. I did the blocks, did the duct tape. Perfect. Okay. And now I can tell my partner, you no longer have to hold his neck because he's perfectly C-spine. He's good now. Okay. Now that he's on the backboard, we're going to do PMS. All right, Kevin. I'm going to feel for bilateral pulses. If I do only one pulse at a time, it's a crit fail, and I'm wrong. I lose. I have to redo everything. Feeling for bilateral pulses. There's no pulse in this one, which is good, and there's pulse in this one. Kevin, can you squeeze my fingers for me? Perfect. Okay. And then, which finger am I touching? pushing? Your pointer finger? Good. Okay. Going down to his feet, I'm feeling for bilateral pulses. I feel bilateral pulses. Kevin, can you raise your toes to your nose? And you can push down on the gas, like, okay? And then is inside or outside? Outside. Is inside or outside? Outside. Perfect. Kevin's on top of that with the PMS. PMS is done. We're going to get him in the ambulance, and we're driving now. We are driving to the hospital. We're transporting him. And while we're in here, since he was in shock, we're going to treat for shock. We're going to crank up the heat in the ambulance really hot. It's going to be very hot in here because he is cold. We're cranking it up there. We'll also put him on we already have him on high flow oxygen. We're going to keep the high flow oxygen going to do the best we can. He is already supine. He's laying flat, which is what you want when they're having shock. You want more blood to be able to flow up, kind of thing. So yeah, maybe we'll raise his feet a little bit. But yeah, so that's all good there. Now that he's here, we're going to take his vitals. So I'm going to have my partner take his vitals for his respiration rate and quality. We're going to also be taking vitals for his pulse and vitals for his for his blood pressure. Okay. The blood pressure comes back and everything is good. They all are like good values. So I'm not super worried about it. I'm going to keep going with what we have because, we're good now, okay? He did vital signs, and now we're going to be going through ample. So, okay, 7. So, do you have any allergies to anything? No. Are you on any medication? You're not, okay. Do you have any medical history that we need to know about for this? No. Okay, and when did you last eat? About 2 hours ago. Okay. And so right now, Kevin, you told me you were at the park, chilling on the bench, you got shot by your ops, you are not allergic to any medications, you're not currently on any medications, and you ate 2 hours ago. Is that all correct? Yeah, that's correct. You have such good memory. Good job, man. You're so good at this. Oh my gosh. Woo. No, there's the camera. I'm like, I'm looking up there. I keep looking up there for the camera. I'm like, it's right there. All right, so he's good for all that. Okay, perfect. So now that we've done all this, we can actually do the big IPA time. You guys raise the legs, shock. Yeah. So now we're going to be doing the big IPA time. So we're going to go to the top of the head, and I'm going to look. You always look first. I'm looking at the top of the head. Do I see any hematomas? Do I see any decap BTLS? I'm looking for hematomas. I'm looking for any concavities in the head where he may have smashed it. I don't see any at the top of the head. Okay. Now I'm going to go down to the eyes. I'm looking at eyes for pearl, which means the pupils are equal and reactive to light. I hope you guys can still hear me, by the way. But if you can't ever hear me, just let me know. They're equal and reactive to light. Okay. I'm also looking for any raccoon eyes, which would signify he has a skull fracture. Okay. Now I'm moving down to the ears. I'm looking for any cerebral spinal fluid or blood leaking out. Any decap BTLS. I don't see any. I'm also looking for any battle signs behind his ear, which is bruising behind the ear right here. That would signify he has a basilar skull fracture. I'm now moving down to his nose, and in his nose, I'm looking for any bleeding, cerebral spinal fluid, or any deformities. I could say the nose is bashed in. Looking for any decap BTLS. I don't see any, which is good. Now moving down to his mouth. Kevin, can you smile for me? Okay. Can you open your mouth as well? Okay. I don't see any bleeding in his mouth, which would seem to be a worry, because if he swallowed up blood and he vomits it up, then he's going to be choking on his vomit. He's not doing that. Good. Okay. And I don't see any broken teeth. I don't see any dentures. I don't see any retainers. I'm not worried about his airway because of any of those things. No broken teeth. Seems good. Moving down, I'm going to be looking at his looking at his cheekbones and his jaw. Any decap BTLS, and I don't see any. We're now going to move down to his neck. I'm going to look for any JVD, which is jugular venous distension. I'm looking for any trachea, making sure the trachea is still midline. They both seem to be. There's no JVD and the trachea is midline, so I'm not worried about either of the things from that. Which, if there was a JVD, would be an example of a cardiac tamponade, which is not good, and I can't do anything about that. He does not have that, which is good, and I don't see any. It could also be an example of late-stage pneumothorax, tension pneumothorax, and then for the trachea being midline, the trachea was not in the middle of the neck. It would be an example of a tension pneumothorax, where his lung is now not working. I don't see any of that, and I would also feel crepitus, like with the oxygen thing, like little air pockets. I don't see any of that. So now going down to his chest area, I'm going to, sir, he's already been trauma naked, so I'm just looking at his chest. I'm looking at his chest for any decap BTLS, any scarring, any bruising, any deformities, any abrasions, anything like that. I don't see any of that. Okay. Sir, I'm going to push on your clavicle to make sure I'm going to push in, and then it's not moving. Okay. Now I'm looking, sir, I'm going to put my hand on your sternum, and I'm going to push down. That's right here. Does that hurt? No. Oh, I want to push in on your ribs and take a big deep breath for me. Does that hurt? No? Okay. I'm going to listen to his lungs here, here, and here, here, and here. I can't get the back lungs right now because he's on a backboard. That's lungs are equal and bilateral. Okay. Now I'm going to move down to the abdomen. Okay. I'm going to be inspecting for any DKBTLS. I don't see any. I'm going to be palpating. I'm going to palpate all four quadrants. So 1, 2, 3, 4. So 1, 2, 3, 4. And I'm feeling for any distension, any tenderness, any rebound tenderness, any guarding, or for any what's it called, rigidity. I don't feel any of them. Perfect. Now I'm going down to the pelvis. So I'm going to open the book, which is this, the opening, and I'm going to close the book on the pelvis. Does that make you hurt or feel better at all? No? Means that his pelvis is stable. That's good. Pelvis is stable. Now we can go down the legs. I'm going to do offsetting, something like this. So basically offsetting is just checking the limbs like this. Go take your drugs, have fun. Making sure that they're not broken or anything like that. They don't seem to be, which is good. And then now, oh, there it is. Okay, now I'm going to be going down to the feet. So now that I'm at the feet, I'm going to do PMS again. So I'm feeling for bilateral pulses. I do feel them. Toes to nose. Feet down on the gas pedal. Inside, outside, outside, inside, outside, outside. Okay. Going up to the arms. Offsetting pressure. Offsetting, offsetting. Okay, now PMS. So I'm feeling for pulse. There's no pulse. There is a pulse. That's good. Oh, wait, what if there is a pulse? I tighten the stat back down so there's no pulse, so there's no bleeding. Okay, and then now for the I've done so this the pulse. There's no pulse in this one. There's pulse in this one. What finger am I touching? What finger am I touching? And then you can squeeze my fingers. Okay, you can squeeze both fingers. PMS is good. What we're going to be doing for this patient is now that we're in a safe area where I can do it, I'm going to dress this wound, put some gauze on, wrap it around. It's dressed now. So he has his wound dressed. Every about 5 minutes, I'm going to check on make sure the tourniquet's still on, and we assessing him to make sure he's an alert and oriented ×4, and so he's not having ultra level consciousness, and we're checking his vitals every 5 minutes so I can know if I need to change anything. Boom! Boom! I'm fucking locked in, baby. I'm locked the fuck in, man. I'm locked the fuck in, man. Okay, only one left. So we just finished trauma. So now I will do the biceps. The biceps. 1, 2, 3, 4, 5. I don't forget that shit, man. Alright, perfect. Whew. Alright, so the trauma's done. Now we're going to probably the hardest. I like to say this is the hardest one, even though some people think the other thing's harder. We're going to be doing a mega code, okay? Mega code. It's just kind of like a combination of the two almost, but we learned mega code way earlier. Hey, what's up? Oh, Asta. You must have said that a long time ago. I do have a pulse ox in my backpack. One sec, let me get it out. My bad, Asta. I just wasn't looking at chat. Fucking pen lights always want to fucking go on in here. It's annoying as shit. Let's see what my temperature is. Ooh. That's what my pulse ox on. The pulse ox. I got a nice pulse ox too. Pulse ox. Am I dying, chat? I think I'm not doing too hot. 95 saturated oxygen is not the best. 114 systolic. I'm moving around a decent amount. It's calming down now and my oxygen is going up. Talking and doing this makes your shit go like crazy. You get so many points for everything you did right. Yeah. Alright, so now we're going to be moving on to your fancy, I know. How you doing, Astor? Are you in the medical field at all, or no? You seem to know what pulse ox is. Are you doing anything medicine-wise? We'll take a little break before we go on to the mega code, and then we'll be doing mega code. So many horror stories. Oh, I can tell you guys this. So I did a ride-along last Saturday. Wait, was it last? Yeah, last Saturday, which is why I didn't stream. So I did a ride-along last Saturday. So I need to have a total of 10 ride-alongs for my EMT course. It's like 10 patient contacts and 24 hours of ride-alongs. There's 20. You get dropped. How'd you get dropped? Like you got dropped down to the ground, Kino, or you got dropped from the thing? But basically, so I did 26 hours of ride-alongs, and on my first ride-along, I got 5 patient contacts. My second one, I got 2, because I had to take a prisoner. So we had to pick up a prisoner from a hospital and take him all the way to a prison, and that took like 7 hours. It was insane, dude. Chill, dude. I don't know what he did. He was chillish guy. You know, he didn't do anything bad to me. But yeah, took him to the prison. Because I live like in more like a suburban city area, like city kind of thing. So we went to like a place, and we had to pick him up, and we had to drive him to the desert. So when I get to the desert, let me show a photo of it. There's a photo of my phone. One sec. Let me make sure you guys can see anything. Let's see. Go to library. Oh, also what's it called? You casually on a chair, right? Oh, so they're gonna drop you from the chair. So also, what was it? A casino came out and talked to us and said if anyone wants to hire, they're like offering to hire EMTs. The casino was, so maybe I'll do that. Unconscious, not breathing. Okay, I got you. Yeah, we use mannequins for all that. Let me see. Okay, so we drove out to the fucking desert, man. And let me see. I took some photos of this stuff. Let me see. So here's what it looks like. How does this look? You see that? You see the? Let me move it closer. You see that the guard tower in the distance there? This guy's both bigger than me, by the way. One guy was like this, and one guy was angles to try to pick me up. Brother, they dropped you. That's crazy, man. That's kind of fucked up. And then we're in the back. We literally just have country. We're literally driving back, right? And so, since I'm doing ride along, the 2 EMTs I'm with start playing music. Well, we're driving through the fucking desert, dude. It was like a road trip vibe. It was super chill. And you know, like in those Area 52, it was so hot out there. And you know how what's it called? Like in like old cartoons, like a jail warden, like, or like even in sitcoms, say like a jail warden will have to get keys and open. They'll go through like 15, 20 keys to get a door open, and they'll say like sometime later, and then they'll come back and open it. So the bathroom door was locked. So the guy had to go through like 80 keys to unlock it. he went through a whole key ring of like 50 keys, and then had to get a second key ring. Wonderful. I'm sitting there, like, dude, I could have held it for 4 hours, man. I feel bad for you. Like 4 hours, I can handle the drive back. It's fine. But yeah, it was crazy. And then I bought a scorpion inside of a lollipop as a gag gift. But so I want to point out this temperature, right? Look at the temperature here. Anyone from Europe can't understand this if it comes through. You see it? Does it show? 120. 120, dude. There's 120 out there. Fahrenheit. Insane. Which is 47 degrees. So right when I was leaving, this would have been at what time? This would have been, just show when it was. Not when I was, it was kind of when I was getting close. It was so hot. It was like 50-ish degrees Celsius, I think. And then the one that I did last year, I had a heart attack in the middle of 2 other casualties being treated by so it was a test of multitasking. Why are they using you guys as people that having things? Why don't they just use like a mannequin? Why don't they have a bunch of mannequins? Because yeah, you're not supposed to pick people fucking up. That's kind of annoying. You fucking having a heart attack, dying. It's triage scenarios, right? Yeah. I feel you. Okay. But yeah, asked in YouTube, are you part of any medical thing? Is you know postdocs like on that? You're on point with that. It sounds like fun. Very very fun. Getting dropped, having to lay on the floor. Oh, national contest. That's crazy. You're doing the health national contest stuff. That's kind of nice. Though. That's kind of chill. Okay, so we're gonna move on to, let's see, what time is it? 12:13. So I have my haircut at 1. So we're gonna roll through a mega code real quick, and then we're probably gonna end it off there. When they call 911, very funny. Hey, what's your guys' fucking number for 911? You used to have a different number up in the UK for that. Isn't it like, I want to say, like, I've heard it, I just can't remember, like 411 or something like that? Forget. Alright, so let's go through this, okay? So I can't do everything here. Oh, it's 999. So oh, I see. Oh, they called 911. Oh, they called 911. That's stupid. Oh, they called 911. Oh my gosh. South Africa was a lifeguard and did some basic. Okay, nice. Oh, nice. Psychology. Yeah, I have my degree in biology with emphasis in cellular and molecular biology. So yeah, that's nice. Psychology is pretty chill. I knew some psychology people in my gen ed, and then after that, I didn't see them again for a while, at all. Unless I kept in touch, obviously. But yeah, nice. Fun. Yeah. This here. Let's see what temperature you guys. Say cheese, chat. Oh, you guys are fucking dead, man. You guys are dead. Oh shit. Chat, no. No, chat. You guys died. No teams got it? Wait. No one knows the symptoms of spinal injuries? How do you know the symptoms of it? Oh! Point. I made a mistake. Big point. I failed because of this. When I was doing the check right between the legs, I forgot to check for priapism, which is a boner. You have to check for a boner if it's a dude, or any genital bleeding in general. I failed because of that. Fuck. Because that'd be an example of a spinal injury if they have a boner. Which is it's called priapism. It means that they have a boner. It means there's an injury to the spine in that area, and it's causing them to have an erection, which is not good. I forgot to check. I can't do anything about it, but I need to check it at least. So I failed because I made a mistake with it. You're so much more reliable at checking vitals. Oh, so yeah. So one of the things is EMTs. So in America, right, the way that EMTs take blood pressure and do blood pressure. I think it might be oxygen treatment. I forget. Maybe not oxygen. I know for checking blood pressure, it's like the. Oh no, sorry. I'm totally thinking something else. For I don't know why did I mix it up? In America, EMTs tend to have the best CPR skills, which is funny. Whereas we get paid like dog shit compared to I'm not an EMT yet. I still have to finish my skills, graduate from my school, and then I have to take the NREMT test, right? Like the actual test and pass that. So I'm not done yet. I'm just ignoring the scenario. Someone fell off a ladder, and I'm like, we check blood glucose. We don't have we don't get tested on it, but we know how to do it. Yeah, we would. Especially if we probably would only do it if they have an altered level of consciousness, or if we know that they're diabetic though. Like we probably wouldn't do it for a random person unless they're unconscious. So for instance, say we go to someone and they're like, oh, what's your name? They're like, oh, my name's Greg. Okay, what year is it? They're like 1995, or they're like 2020, or if they're like, where are we? They're like, my home, and they're in like the hospital or they're at a park. Then we would do blood glucose, 100% to check. But yeah, how they forget? So the thing is, we're trained if there, if there's ever any trauma, we always are treating as if they have any back pain, we're treating for that. We're treating for any spinal injuries, which is why we put them in a board. We do all that stuff. Okay, so now we're gonna move on to. Let's see where I want to arrange things. Fun. Lots of learning. Okay, so we have Kevin here. Kevin's been going through the rigmaroles today, okay? Kevin is at Starbucks, and he is the call is there's an elderly man at Starbucks who's complaining of issues breathing. He's having breathing difficulties. All right, Kevin, perfect. And I won't be able to do all of this actually here because I don't have an AED, a fake practice AED. I don't have a partner, so I'm going to verbalize some of it that I would have to actually do. So just so you guys know where I'm coming from and why things might not be exactly the way it's supposed to be. So we're putting we can just do Starbucks elderly man reporting of respiratory distress. So BSI and safety. The scene is safe. Basically, I'm putting my PPE on, looking for any environmental hazards. I don't see any. Seems to be one patient. And mechanism of injury, nature of illness. I'm not sure. It seems to be nature of illness based on the call. But just in case, I will keep in the back of my mind. It could be a mechanism of injury. You're gonna have to see me in the mirror, by the way, guys, just because of the angle. And then basically, I'm gonna call for additional resources. And if I don't need them, I can just cancel. And I don't think I need for C-spine or extrication at this point, but I will keep that in mind just in case he did end up having a fall or something. But at this time, it doesn't seem like that. So my current general impression is I have an elderly man who is sitting like this. He's having a little bit harder time breathing. Maybe gasping a little bit, cool pale diaphoretic looking. Is that true? Yeah, that's true. That's what he looks like. Okay, that's not great. And then is there any life threats? No, there's no life threats. He's not bleeding or anything. Okay, good. Okay, so now I'm going to go, hello sir, my name is Jay. I'm your EMT today. What's your name? Kevin. Okay, Kevin. Third Kevin of the day. I've been having a lot of Kevins today. I call it Kevin because we call all of our mannequins at the school Kevin, which is funny. How they just wait, let's see. Oh, they pulled up Chatterino because Chatterino I can't see. I was looking at the other chat. Oh yeah, 100% in case because in case they hit off the concrete or something, or if they hit the bottom of their feet or their neck. So say someone jumps off a ladder, you'd be checking their knees and legs. So say the thing is, we're trained if they have say they have a massive broken leg and I can see the bone sticking out of it. I don't give a fuck about that. I don't watch my language, but I don't care. I don't care about their leg. I care about their spine. Because if something hits here, it's traveling all up their back and their body. I don't care about their broken leg at this point. I'll go back to that. But yeah. So that's how we're trained. Yeah, I don't really care. You can have 8 broken eight breaks in your legs. I don't care. I care about your spine. Because if someone has a femur fracture and their femur's broken, that means that they probably have a very damaged spine. Because if there's enough force to break that femur's the strongest bone in your body, something can break that, you're not doing well, huh? You're not doing well. Okay, so now we're going to be going back to this. I think I was at, I did Penman, I did ASPU, he's one range, I didn't do ASPU yet. I did Penman, I did general impression, and life threats. There's no life threats. Alright, so I think I did go, your name's Kevin, I started ASPU. Name's Kevin, okay, a lot of Kevins today. What year is it? It's 2024. Okay, and where are we at right now, Kevin? We're at your home. Sorry, what's Starbucks? Okay, and then how old are you? You're 70. Okay, and why were we called out here today, Kevin? Why was 911 called? Well, I didn't call 911. Okay, so someone called 911 for Kevin in this case. Okay, good to know. I just wanted to clarify. So someone called because it seems like you're having some breathing issues. So I'm just going to check you out, okay? So first things we're going to do, we're going to ABC. So his chief complaint is of breathing issues, of difficulty breathing. So his area seems pain and maintainable. He is talking to me. He's not unable to talk to me. Breathing, I'm looking for equal and bilateral virus follow chest. I do see that, but it seems labored. I'm going to throw pulse ox on. 85. Okay, we're going to put so basically all this part I'm doing right now, I have to do all this part. So in other ones where I'm saying I put non-breathing on, this one I actually have to show it. So this is going to be our oxygen canister, okay? This is our oxygen canister. You have to watch in the mirror, okay, guys? So I have to hold it. I can never stop touching it. I always have to be touching it. Actually, let me just move this back. So I always have to be touching the oxygen canister when it's up. I cannot let it not be touched. So I'm holding it between my my knees right now, or whatever. Right, so oxygen canister is there. So now what I'm gonna do is I'm gonna use this as my crank. So I'm gonna to let any dust out and close it back up because this is the top crank bit. And I'm gonna get my regulator. Right, see, we're trying really hard. So I'm gonna get all the things I need. So I have my regulator up. I got this is the only actual medical thing I have that I can use here. So this is a nasal cannula, but we're gonna pretend it's just tubing. Okay, it's just tubing. Okay, so we're getting the see. So we blow that out, getting this out, just getting everything out. I might need. I'll use this mask as a non-breather mask, and we'll use this as a BVM. Okay. So basically, all I'm doing is I'm getting this oxygen tank out. I'm cranking this to get the dust out. Okay. This is out. I'm gonna get the O-ring out. So this is this is not O-ring. This is the regulator. So the regulator, I'm checking to make sure that that the O-ring is there. So the O-ring is there. Okay, and it's set to 0 so far. And I'm gonna attach it on. It's attached on, and then I'm gonna get it in the right spot and then twist it on. Okay, so now it's attached. Okay, it's on. Now I'm gonna open the tank all the way. Tank's all the way open, and then back a quarter. So back a quarter. Okay. So now make sure it's all the way up, and I'm gonna check the tank. So I'm gonna check the tank pressure. It's between 500 and 2,000. Okay, so that's working. And then we're gonna listen for any leaks. So I'm gonna turn it up to 15. Sorry, I'm gonna keep it this. I don't hear any leaks. Turning it up to 15. No leaks. Okay. I'm attaching the non-breather. What's it called? Non-breathing mask tubing. The tubing's connecting to the right port. This is all connecting to the mask, right? Okay. Let me move this. What is that? Fall from spinal. Yeah, fall from spinal is big. 1 sec. Okay, correct. Everything fell. No, Kevin's gonna die. Doing good, Kevin. Doing good, man. Okay, no news messages. Perfect. So we're checking for any leaks. Attaching it to the right port. Everything's good there. Now it's on. I'm gonna take the reservoir bag of the mask, which will pretend it's attached. I'm gonna put my finger here and make sure it's filling. Fill about 2/3 or enough that it's not fully full, but it's full enough. And then I'm gonna attach it. I'm gonna put it over him. Right, so it's already at 15 liters per minute. Did I put it here? When I said that, I guess I just said it now. Or I said before. I also just said it now. 15 liters. We'll put it over him. I'm gonna put it around his ear, so it's gonna be like this. I'm gonna cinch right here. I'm gonna pinch it, so it has a good seal. So there's a good seal on that mask, and so that's all good. So all this is done. It's on him. He's having that extra oxygen. Okay, all that is done. So now we're gonna check his circulation. So I'm looking for any bleeding. I'm feeling for a pulse, and I'm feeling and looking at his circulating skin. So he's pale, cold, diaphoretic, which is not good. There's no bleeding, and his pulse is weak but rapid. But he still has a pulse. Okay. So right now this is a priority patient who I really want to transfer. So we're going to start transporting him. So we're going to get him into the ambulance. Okay. Now we're in the ambulance. Okay, Kevin. He's a preparing patient. I'm prepared for transport. So Kevin, what were you doing when it started? There was no response. Hey Kevin. Hey Kevin. No response. I'm going to trap pinch. So I'm taking it here and I'm pinching really fucking hard. No response. Okay, that's not good. We're taking him down to the ground. And the thing is, when I take him to the ground, I'm going to rip off that mask. I'm going to detach it because I need to be. So there's a certain step I have to do where I'm getting timed at a certain spot. So now I'm taking him to the ground, taking that mask off, untouching it. I'm going to have my BVM ready to attach because I need to have that already ready. All right, so Kevin's on the ground now. I'm going to look, listen, feel. I'm feeling for a carotid pulse. I'm looking and for a rise and fall of the chest. And I'm listening for breathing. I see no rise and fall of the chest. I hear no breathing, but I do feel a weak carotid pulse. Okay, so Kevin's not breathing anymore. Kevin is not breathing. I'm going to go behind him, and I can do a head tilt chin lift. But I like doing jaw thrust. So I'm going to do a jaw thrust so that his tongue is no longer on the back of his throat. And then I'm going to go like this. And I'm going to open his mouth up. It's full of vomit. Fuck. That's not good. That's not good, Kevin. Okay. So I'm going to get my suction machine. This is now my suction machine, okay? Suction machine, and this is my, I'm going to say this is my suction thing. So I'm going to take the suction machine, I'm going to turn it on, I'm going to test it against my gloved hand. It is working, okay? I'm going to open up the mouth, and I'm not going to suck, there's no suction happening. My finger's not on the suction machine, the thing. I'm going to put it in the mouth, I'm suctioning for less than 15 seconds in a sideways motion. And suction on the way out. I'm going to check the mouth again. Is there any vomit? The airway's clear. Now start the 30-second timer right now. So now I'm going to take this tubing, I'm going to attach it to the BVM, attaching it to the BVM, and then I'm going to take the OPA, which is like a thing like this, kind of like a hook, to keep the tongue down. So I'm going to put it in his mouth on the side, twist it down and put the tongue down, the OPA is now in, and I'm going to get behind him with the oxygen, the BVM that is now attached, and I make a CE grip. So it's like a CE. So I'm having the C on the actual mask portion. That this is going under the chin, just like this. To make a really good seal. I'm pushing down to make a good seal. Doing that, and then I'm going to go every 6 seconds. I'm going to deliver one rescue breath. I do that for 2 minutes. I'm making sure that there's rise and fall of the chest so I know that it is working. So I do that for 2 minutes. And after 2 minutes, I stop. I'm going to look, listen, feel. I'm looking for rise and fall of the chest. I'm listening for breathing, and I'm feeling for a carotid pulse. There's no carotid pulse. He's now no longer has a heartbeat. I'm going to start CPR, and because I don't want to break this, I'm just going to do CPR like weaker. I'm doing CPR, and I'm going to say to my partner, update ALS that he is now crashing and get me an AED. Okay? And while they're getting me an AED, they're gonna ask me, what am I doing? What am I doing right now with CPR? So I'm making sure I'm doing 100 to 120 compressions per minute. I'm just gonna stop doing compressions, but you know what I'm doing. 100 to 120 compressions per minute. I'm doing it so that I'm allowing for full rebound of the chest. The chest is recoiling and having full recoil. I'm minimizing any interruptions, and I'm doing 2 to 2.4 inches of down, and I think that's it. Am I missing one? And I'm doing 30 compressions for every 2 breaths if I had another partner here. Right? Let me check to make sure that's correct. Yes, I got all of them. Okay, perfect. So I do this for 2 minutes, or however long it takes my partner to come back with the AED, okay? Partner comes back with the AED. And because they're testing me, in real life, my partner's going to put the patches on and do the AED stuff. But in this situation, they want to make sure I know how to do it. So I'm going to say, okay, partner, on 3, we're going to switch, okay? 1, 2, 3. I get off, and they start doing CPR. I take the AED, I'm going to throw the pads on in the right spots, and then I'm going to turn the AED on. AED is turned on. I'm now going to plug it in, plug the pads into the AED, and it's going to go and it's going to say, something like analyzing patient. Like, clear off the patient, no compressions. They're analyzing heart rate. And then it's going to say shock detected, or shock available. Say get back on. So they're doing CPR, and it's going to say charging. And so this is them right now. They're doing this, and the machine says charging. And it says clear the patient. I say don't clear the patient. Keep going until it says ready to shock. And then I say get off the patient. I'm clear. You're clear. We're both clear. Shock delivered. Get back on the patient and count each compression you do, and then they're gonna go 1, 2, 3, 4. They're gonna count to 30, and when it hits 30, I'm gonna go. And they're gonna go again. We do that for 5 cycles. 5 cycles later, which is about 2 minutes, I'm gonna look, listen, feel. Looking for a rise and fall of chest. Listening for breathing, and I'm feeling for cardiac pulse. He's alive. He's back alive. We survived. We saved Kevin. Baba booey, baba booey, baba booey, baba booey, baba booey. Bing bong, bing bong. How was that, chat? I saved Kevin. Kevin's alive, but all of his ribs are broken and he's brittle and in a lot of pain. CPR. Let's go, baby. How did I do, chat? How did I do? You just trust me to save you guys if you guys have a heart attack or stop breathing or anything? I got you, bro. I got you, chat. I got you. How do I see how many people are watching on YouTube? Where do I see that? I can't see it just from the regular tab. Let me pull this out a little bigger. Yeah, there we go. Bing bong. Yeah, that was pretty good, wasn't it? What you guys think? I just need to iron out a few more things. I'm still making a few small, little, teeny bitty, itsy bitsy spider, little mistakes, which is not good. I just really need to hammer those last few things out to make sure I know them, because I really just need to know them, not only just for testing, but to know how to actually help someone, right, if I need to. So I just need to do this last few things. Where was that thing? One sec. I'm blind. to throw this in here in case anyone doesn't want to join if they are there. But yeah, I just need to really narrow in on those few final things, and then I'll be good. So just a little bit more learning to go. And then yeah, I'm sweaty now, which is fucking annoying. But yeah, into everything. I really need to. I think the biggest thing I need to do is really hone in on all the bits of trauma, because you saw trauma took the most amount of time, has the most effort to it. I would say. I think the easiest is going to be medical. Hopefully it should be, and then obviously mega code has a lot going on as well. But just figuring everything out, and I think it'll be good. Just trying to figure everything out. Yeah. Just figuring it out. Get going. I don't like. I hate how my hair looks with that product in it. Same. Too floofy. Too floofy. Because I'm getting a haircut in. Oh, and I have this in case. So I know we did the shooting aspect of it. If someone did need a splinted thing, you would basically just do the splint on their thing. You can use cardboard. Obviously, you probably wouldn't want to use cardboard, but you can use cardboard for a splint. It actually does work. And if it's you would do PMS before you do the splint. You would put the splint on. You do PMS after. Make sure you didn't cut off anything, any like circulation or anything like that. And you shouldn't do it. Yeah, just do the split, and then you wrap it proximal to distal. That's just how you do it. Yeah, that's pretty much it. Pretty much it, chat. Pretty much it. Bing bong, bing bong, boom boom. Yeah, we just did enjoy. I think mine's here though, so I gotta go. I gotta run in. At my haircut in 26 minutes. I love you all. Thank you for coming out. I know this is very extreme to my normal content. Hope you guys did still enjoy, and I'll see you guys next one. Bye bye. Au revoir. Let's see. Yeah. I tried some more cramming to do. Just figure it out. Yeah. I hope you guys had a good stream. Hope you guys enjoyed, and I'll see you next one. Bye bye. Bye bye. Oh, I already kind of showed it off to some people, but I'll show this off real quick. Hold up. Wait a minute. Tell me this doesn't look clean as fuck though. Look at this thing. Oh my gosh. Hold up, baby girl. Look at this shit. What the fuck? Holy shit, man. Holy. I just need to figure out where to put it still. It's still in my. Also, look at these. I got this sent from my great aunt, dude. Look at these. This is my grandfather's parents. So this is my great grandparents. This is my. I think this is my great grandmother. Yeah, great grandmother. And then here's my grandfather right here. And I have all the other names. But yeah, look at all these people. Dude, so this one right here, I think this one is I forget which one that is. I have all this stuff written on the back. One sec. Let's see. Oh, okay. So that's it there. Okay. So let me put this back on. So that would be that's so long ago. Jeez. Alright, so these people right here in the middle, these are both my great grandparents. So this woman right here is the same woman right here. Yeah, it's crazy. And then this is, I think, her when she was a younger kid. So this one's like the oldest photo. I know this photo's from 1941. So these are old photos. Pretty nice to see. Hang this back up on my wall. But yeah, I'm not gonna give you a crotch shot. Get out of here, you weirdos. But yeah, just enjoy. I'll see you guys next one. Bye, chat. Bye bye. Au revoir. Au revoir. Je m'en vais. Au revoir. See you later. Au revoir. Woo. Wait, I missed like. Bye bye. Alright, YouTube. It's just you. Bye bye, YouTube.